I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives, where I also serve as chair of the Congressional Progressive Caucus. First, I want to start by expressing my gratitude for your fabulous advocacy on the crucial issue of healthcare access in our state. Your mission to achieve high-quality, publicly funded healthcare for all Washington residents is really inspiring, and it resonates deeply with me. I am endlessly thankful for organizations like Healthcare for All that rally grassroots support to work and advance legislation on this issue. As many of you know, I am the lead sponsor of the Medicare for All Act, our country's most comprehensive plan to transition to a single-payer universal healthcare system that will finally put people over profits. Last year in Congress, we had 112 members sign on as co-sponsors at introduction. That's more than half of the Democratic caucus in the House, and it included many of our powerful committee ranking members. It's a big number that signifies that we do have wide support that Medicare for All should be our country's healthcare system. And that is in no small part thanks to all of you organizers across the country who have been fighting so hard with us for this vital legislation, and with your help, we will continue to grow that number. Now let's be real. Our healthcare system is broken. 85 million people are uninsured or underinsured in the richest nation on earth, and millions of people are drowning in medical debt. The devastating COVID pandemic has underscored that Medicare for All can't wait, that 27 million people lost healthcare when they lost their jobs is unacceptable. And when Black, Brown, and Indigenous people suffered the worst losses, we know that's unacceptable. We deserve better. The Medicare for All Act is good legislation that isn't just transformative, it is actually really popular too. It's supported by 70% of registered voters and has been endorsed by over 100 local governments. People deserve and want comprehensive health care that includes mental health, long-term care, reproductive care, dental, vision, and hearing, all of that with no co-pays, private insurance premiums, deductibles, or other hidden fees that insurance companies love to sneak in. Getting this legislation passed is obviously going to be a big battle. We need more co-sponsors in Congress, and we have to build support from the ground up. No matter if we're talking about state or federal single-payer healthcare, we are also still talking about the same principle, healthcare being a human right. State-based plans show us what can be done in the effort to provide comprehensive healthcare at a large scale, serving as a model for what a country with guaranteed healthcare could look like. Also gives us momentum in our push for federal Medicare for All legislation. Now, some states will refuse to adopt these plans, hurling some of our most underserved and marginalized communities under the bus. That is why we have to continue to fight to pass Medicare for All at the national level and guarantee healthcare as a human right to every single American, no matter what state you live in. In Congress, we're continuing the important work to build the support that we need with both inside and outside groups, and to make the state-based Universal Health Care Act and Medicare for All a reality. None of this happens without you. We have to organize like our lives depend on it, because actually they really do. So here's my commitment to you. We've shown what we can do together, and I am never going to stop fighting for this, because it is urgent that we finally guarantee healthcare to everyone as a human right. Thank you for all your hard work, and know that I'm fighting right alongside you in the halls of Congress every step of the way.